Delsym Suspension is an over-the-counter cough suppressant medication containing dextromethorphan polistirex as the active ingredient. It provides long-lasting relief from cough associated with colds, flu, or respiratory infections. Indications: Delsym suspension is indicated for the temporary relief of cough due to minor throat and bronchial irritation, as may occur with a common cold or inhaled irritants. How to use: Delsym suspension is taken orally. Check the bottle valve before its use. Use the provided measuring device to ensure accurate dosage. Do not mix Delsym suspension with other liquids or medications unless directed by healthcare provider. The dosage of Delsym suspension is individualized based on age, weight, and severity of symptoms. Adults and children 12 years and older take 10 ml 2 teaspoons every 12 hours. Do not exceed 20 ml 4 teaspoons in 24 hours. Children 6 to under 12 years take 5 ml 1 teaspoon every 12 hours. Do not exceed 10 ml 2 teaspoons in 24 hours. Children under 6 years consult a healthcare provider for appropriate dosage instructions. Contraindications: Delsym suspension is contraindicated in individuals with hypersensitivity or allergy to dextromethorphan or any components of the formulation, chronic cough due to smoking, emphysema, or chronic bronchitis, use of monoamine oxidase inhibitors within the past 14 days. Special instructions: Patients should drink plenty of fluids to stay hydrated while taking Delsym suspension. Delsym suspension is intended for short-term use to relieve acute cough symptoms. Prolonged use should be avoided without consulting a healthcare provider. Patients should avoid consuming alcohol while taking Delsym suspension, as it may increase the risk of drowsiness or dizziness. Side effects: Common side effects of Delsym suspension may include drowsiness, dizziness, nausea, vomiting, constipation, headache. Serious side effects are rare but may include allergic reactions and difficulty breathing. Any unexpected or severe side effect should be reported to the healthcare provider promptly.